This is WECT's Medical Monday, featuring your local Health First partners. Let's talk to Health First partner Derm One Dermatology Center.
Hello and welcome back. Today I'm joined by Dr. Jonathan Crane from Derm One. How are you, Dr. Crane?
Great. How are you today?
I'm doing well, thank you.
Thanks for having me here.
If people want to take advantage of this time of year to, rejuvenize their face, what kind of options are there for them?
I'll tell you, the biggest thing that we have, which really starts probably September, October, November, December, and then really carries through till about March, is fractionated CO2 resurfacing. And basically what happens, we take a laser and it literally punches small holes in the skin, and the holes heal from the sides and tighten the skin. So we go over the whole face with it. We usually do it about every 3 weeks or so for a total of about 3 to 4 treatments, and it's amazing how much it tightens the skin.
Okay, what kind of downtime does something like that have?
It's about 1 week of downtime after each fractionated CO2 treatment. Years ago, the Fraxa laser was the first laser to come out with this sort of technology, and it sort of punched holes into the skin, but the problem was it didn't go deep enough. So then they came out with CO2 laser, which is a more powerful type of laser, and was able to punch a little deeper into the skin. And now we have, which we've been doing for the past 2 years, multi-pulse fractionated CO2, where it hits a spot, hits it again. So basically you're putting pretty deep holes into the skin, but it's amazing how quick it heals because it's healing from the sides in, and it literally just tightens up the face. It really works terrific.
Who is a good candidate for something like this?
Fair to medium skin patients. If you're dark skinned, it doesn't do as well because sometimes it could leave a little bit of irregular pigmentation. So if you're fair skinned and you have loose skin, it is just outstanding.
Okay, sounds like a great option. You can find out more about this by going to derm1nc.com.
Now, let's talk to Health First partner Derm One Aesthetic Facial and Plastic Surgery.
Hello and welcome back to the Cape Fear Business Break. I'm Megan Donahue. Joining me today is Dr. Deidre Blanks from Derm One Dermatology, Cosmetic, and Scarless Vein Care Center. How are you, Dr. Blanks?
I'm doing well.
Let's talk about rhinoplasties.
Well, when you're talking rhinoplasties, I always tell people they can be two things. They can be functional, meaning I can't breathe, or they can be cosmetic, meaning I really just don't like the way my nose looks.
Okay, does somebody have to meet a certain criteria for it to be functional?
You do. For it to be considered functional or for insurance to pay for it, you really have to have a couple of things that have to be done. And one of those is you can't breathe from one side of your nose or the other, or maybe it's both sides. It can be snoring or sleep apnea, where you're truly having a medical issue or difficulty with breathing, or it could truly be things of a sinus issue, whether or not your septum's deviated and you're having difficulty with your sinuses.
Okay, do folks who have deviated septums end up having rhinoplasties?
You do. You know, I always tell people when most people think rhinoplasty, they think, oh, I don't like the tip of my nose, or I don't like the bridge of my nose, it has a hump on it. But truly, sometimes a rhinoplasty is just functional, putting your nose back in the center of your face. Whether it is something that happened when you were a kid, I got hit by a baseball and now I can't breathe, or it's something that maybe you were involved in a car accident. Those truly are rhinoplasties, and when you're thinking of a rhinoplasty, you want to think of it has to work. So you want to go someplace where the doctor's going to think function and cosmetic.
Okay, it sounds like you're that doctor.
Yeah, I agree.
Find out more by going to wilmingtonface.com.
Now, let's talk to Health First partner Derm One Scarless Vein Care.
Hello, thanks for joining us. I'm Megan Donahue. With me today is Dr. Cameron from Derm One Scarless Vein Care. How are you, Dr. Cameron?
I'm doing fine, thank you.
Now, I know my mom would be embarrassed for me to say this, but she has varicose veins, and she has been told in the past that it's mostly cosmetic and to not really worry about it. Is this the right diagnosis?
Well, there are two things. First of all, I think a lot of people are not only embarrassed to talk about the varicose veins, they also try to hide them.
Yes.
And I don't think there's any reason to hide them anymore. The second thing is, in order to have varicose veins, you've already got the disease. You have venous insufficiency. So that's why I think it's so important to seek appropriate help. Nowadays, like everything else in medicine, there's super specialty. People who, like us, we spend our entire time now diagnosing venous insufficiency. So, and we offer free consultation. But regardless, wherever she is at, I think she needs to see a vascular surgeon, let them look at it. and they can usually tell her if there is indeed there's some significant disease that she needs treatment.
Plus, technology has come so far.
Absolutely. I mean, in the old days, still a lot of people inject just saline. We really believe you should do an ultrasound first, see what the pathology is. And once you make a right diagnosis, the treatment usually is very simple. Okay. And some of these things need laser treatment, some need injection. But regardless, we've come a long ways with for the treatment of venous insufficiency. And it is really, in a way, a disability to have this disease. People are embarrassed going out and doing things. So it is so easily treatable. I strongly recommend people seek help for this condition.
Come have a free consultation, right?
Absolutely. Yes.
Find out more at scarlettsbanecare.com.
Now let's talk to Health First partner Ham Hearing Aid Center.
Good afternoon, I'm Megan Donahue, and joining me today is John Clell Ham, owner of Ham Hearing Aid Center. How are you, Clell?
I'm doing great, Megan. How are you?
I'm doing great. What do you have with you today?
Well, today I want to share with our viewers the fact that we have now released the Invisibel 2 in January of 2015. This is the deep insertion hearing aid that we talked about in the past. This is the new generation. And the really cool thing about this generation is the fact that it is now, the chip inside of it is 60% smaller than the previous hearing aid. So what this does is it opens the door for more people with hearing loss to wear something inside the ear that is very small and discreet. So people who have smaller ear canals, you know, there's a limitation. We have to have so much space to build the hearing aid. However, now we can do it for more people. So that's exciting. In addition to that, they have put a new compression platform within the chip that's going to provide for even better management of noise relative to speech. So helping people have a better communication experience in restaurants and in more challenging environments. So I'm really excited, and I know there are a lot of people out there today who probably want to have a hearing aid that's very discreet, and now they have the opportunity to have something custom made that will serve their purposes and provide a better quality of life while at the same time allowing them to look really good.
Yeah, I mean, I can't even see it once you put it
I know.
in.
It's amazing.
Yeah, I think a lot of people would like that option.
Absolutely. So what I would do is, anyone watching right now, just give our office a call, schedule a hearing test and consultation so we can kind of review with those individuals all their options and also discuss the new Invisibel 2 if that should apply to them.
Okay, find out more by going to hamhearingaids.com.
Now let's talk to Health First partner Wilmington Dermatology Center.
I'm Erin Kirk, and with me today is Dr. Rosalind George from Wilmington Dermatology Center. Welcome back, Dr. George.
Thanks for having me.
I can't believe it's already February.
I know, we can't believe it.
It's kind of crazy, but you've got some exciting news that was just announced, that you were recently recognized by Allergan.
Yes, Allergan, the maker of Botox, Voluma, Juvederm, Latisse,
okay.
and also has Skin Medica, the skincare line.
Right.
But we're a Black Diamond account, which means that we're in the top 2% accounts in all the nation.
That's fancy. That's
yeah.
a big deal.
Yeah, we're
2%.
Really excited. So, I mean, you know, we're competing with big
right.
markets, and that just goes to show the experience that we have in providing great results in Wilmington.
That makes
and
sense.
the loyalty and greatness of our customers.
Right.
We're really, really lucky to have such great patients.
Well, and I know you guys do a lot of different specials on certain things, and you have
yes.
one coming up for Valentine's Day.
Yeah, for Valentine's Day. So anybody who's looking for a gift for that special someone, we're having a lot of specials before Valentine's Day on a lot of our products.
Okay, and I know you're also doing a lunchtime kind of lecture on the different options for non-invasive fat loss.
This is the time of year when you want to start thinking about that, because
right.
it does take a little bit of time to see those results. And so we're having that lunchtime lecture, which you can find on our website.
Okay, so I know you're going to talk about some cool sculpting and liposonics, some
exactly.
of the non-invasive things. Okay.
Exactly.
And I know you also have a blog on your website where you're going to give some cold weather skincare tips.
Yes,
what
this is the time of the year where people are just dry and itchy,
right.
and it's basically, you know, making sure you're using very mild soaps, lukewarm water, and using a really good moisturizer.
Okay, well, people can check that out on your website, and you're
yes.
still recruiting for some various studies as
yes,
well?
Yes, psoriasis and rosacea right now. And rosacea, it's the redness of rosacea is what we're looking for, and that's a really hard thing to treat. So we have some good options.
There are a lot of options. If you have any questions or you would like more information, please go to WilmingtonDermatologyCenter.com for more information.
Now let's talk to Health First partner Atlantic Neurosurgical and Spine Specialists.
Hello and welcome back. And joining me today is Dr. George Huffman from Atlantic Neurosurgical and Spine Specialists. How are you, Dr. Huffman?
Doing great, Megan. Thanks for having me back.
We've talked a lot about minimally invasive surgery in our previous segments. Is there any data that shows that minimally invasive surgery is better than, say, the traditional surgery?
Megan, that's interesting. There was a recent article that came out that compared minimally invasive surgery to traditional open spine surgery. And what it found was that at a year's time frame, there was no significant difference in the patient's outcome. However, it found that the patients got to the point they wanted to be much faster. There was far less pain after surgery and a much quicker recovery. So what that shows is that in the long term there's not any real difference if it's done open versus minimally invasively, but that in the short term the patients get better quicker.
Okay, do most physicians do the minimally invasive approach?
So nationwide, less than 20% of spine surgeries are done minimally invasively. And the reason is there's a very steep learning curve with it. And the first few you do are going to take you much longer, and you have to be trained in this. And if you don't do it properly, taking care of the complications can be much more difficult. So with that data, you want to find someone who's done a lot of these and who's very comfortable at doing them. Traditionally in our practice at Atlantic Neurosurgical and Spine Specialists, the majority of our spine surgeries are done from a minimally invasive approach.
Okay, and they can get more information by calling your office or going to your website, and that's atlanticneurosurgery.com.
Now, let's talk to Health First partner Mancini Orthodontics.
Welcome back. I'm Megan Donahue. With me today is Dr. Kevin Mancini from Mancini Orthodontics. Welcome, Dr. Mancini.
Well, thank you, Megan. It's great to be here.
Tell us about your practice.
Well, Mancini Orthodontics is an orthodontic specialty practice. I received additional residency training in order to become an orthodontist.
Okay, and how long have you been in practice?
I've been in practice for over 14 years. I've been a solo practitioner coming on 7 years.
Wow, okay. Now, what types of patients do you see?
At Mancini Orthodontics, we provide orthodontic treatment for children, teens, and adults. We also provide temporomandibular disorder treatment and snoring and sleep apnea treatment.
All right. Well, I know they've made some great advancements in orthodontics. Tell us about some of the things that you offer.
Well, we have many different bracket systems. In part, the variation of systems that we have is to allow the differences in treatment requirements. It's based basically on what the patient presents with as far as their orthodontic needs, as well as patient desires. We are really patient desire driven. We have traditional bracketing system like this system here where the patient can choose colors to express themselves.
Wow.
We have crystal clear brackets with tooth colored wiring, as you can see, for optimal aesthetics. We offer the Wild Smiles shaped bracket system that there's many different shapes that patients can choose if they play sports. There's soccer balls, there's hearts, there's diamonds. It really has expanded the treatment that we can provide. And we also have Invisalign treatment available. And the Invisalign treatment is really for the optimal in aesthetics and comfort.
Great. So many options for people. Thanks so much.
Thank you.
You can find out more at ManciniOrthodontics.com.
Now, let's talk to Health First partner Ortho Wilmington.
Hi, I'm Megan Donahue. Joining me today is one of the region's leading joint replacement specialists, Dr. Walter Frew with Ortho Wilmington. Now, Dr. Frew, tell us a little bit about your area of expertise.
I'm an orthopedic surgeon, which means I specialize in problems with muscles, bones, and joints. I did an extra year of training, we call a fellowship, which helped get me advanced training in hip and knee disorders and their replacement. I perform about 700 or 800 joint replacements a year, of which I'm almost doing a third outpatient or as same-day surgery.
Okay, now I know there's been advances in knee surgery and it's outpatient. How is that possible?
There's really a few different areas that we've improved in the past 5 or so years that have allowed us to do that. Number one is the anesthesia we provide allows patients less pain and quicker, earlier function. There's some medications that we can give patients now, both orally, IV, and even injected around the joint after the replacement, that allows them to get up and going more easily with less pain and better comfort. And then lastly, partial knee replacement surgery, or only replacing one part of the knee and leaving the rest of the knee alone, has also allowed us to get patients up and going quicker.
Okay, now who's a candidate for this?
Well, most importantly, the patient has to have arthritis limited to just the area of the knee that we're going to be replacing. Whereas in a patient who has arthritis in multiple areas of the knee, a total knee replacement is required. But with a partial, we can just replace one area of the knee, therefore giving them quicker function and more normal function.
Okay, what kind of recovery time are we talking about?
Patients are up and walking day of surgery. They're doing stairs day of surgery and walker to a cane within a week or two.
Okay, great. For more information about outpatient knee surgery, go to orthowilmington.com.
Now let's talk to Health First partner Home Instead Senior Care of Wilmington.
Hello and welcome back. I'm Megan Donahue. Today I'm joined by Alex Harmon, Client Care Coordinator with Home Instead Senior Care. Welcome, Alex.
Thank you for having me.
Why is it so important to keep seniors active during the winter season?
It is important to stay active in general, but especially for seniors, to improve their overall health as well as keep their spirits high. This is difficult since there's less light in the wintertime. Some challenges that they may face would be fall risk increase from the weather, as well as many different viruses that tend to pop up.
Right. Now, what are some ways to keep seniors active?
Some ways to keep them active would be go to the mall, go for a walk around the mall, join a gym and do an aerobics class or a water aerobics class. Or if you don't want to leave the house, you could simply get a DVD that is an exercise program.
Okay, and I know there's a lot of classes around here for seniors.
Yes, definitely.
Now, how can Home Instead help seniors with this?
Home Instead can help by our caregivers are able to accompany them to the mall and walk around with them, as well as to different classes at a gym. And if they decide to stay at home and do an exercise program, they're able to help with the setup and different instructions that go along with the video.
All right. Now, what is the first step if people are interested in seeking assistance from a caregiver?
Usually people Google us, which you can simply Google Home Instead Senior Care in Wilmington, and you can find our services there, or you can come by the office. We provide many different services, not only activities, but we can do light housekeeping, meal prep, any kind of med reminders.
All sorts of things. That's
Definitely.
great. Thanks so much for being here.
Thank you.
Find out more by going to homeinstead.com/386.
Now let's talk to Health First partner Allergy Partners of Coastal Carolina.
Hello and welcome back. I'm Megan Donahue. With me today is Dr. Amy Feldman, board certified allergist with Allergy Partners of Coastal Carolina. Welcome back, Dr. Feldman.
Thank you, Megan.
Let's talk about dust mite allergies.
Okay, so dust mites are actually microscopic insects that eat shed human skin, and they like to live in moist areas and fluffy areas. So what they like to live in are pillows, mattresses, and box springs.
Oh, that's great and gross. So how do you get rid of them? Are they dangerous to your health?
So you can't really completely get rid of dust mites. You can limit your avoidance or your exposure to them. And avoidance is one of those ways to do that. So you can buy dust mite encasements which zip up over the pillow, the mattress, the box spring. They also like humidity, so they don't actually drink water. They get their water from the outside environment. So if the humidity is less than 50%, then they can't survive. So some people actually like dehumidifiers. And to answer your other question, they can be dangerous for people who have allergies. There have been some recent studies that show that they are one of the main causes of emergency department visits for asthma.
Oh, well, how do you treat this allergy?
So allergy shots are a good option for people who have a dust mite allergy, and the reason is that you can't really completely avoid dust mites. So the point in allergy shots is that they retrain your immune system to learn to ignore this allergen. So what they are trying to do is basically eliminate your allergy to dust mites.
Okay, and you can get this tested with basic allergy tests?
Yes.
Great. Find out more at allergypartners.com.
Now let's talk to Health First partner Spinal Care of Wilmington.
Hello and welcome back. I'm Megan Donahue. With me today is Dr. Jason Graff from Spinal Care of Wilmington. Welcome back, Dr. Graff.
Thanks for having me.
We've had quite a few viewers email in wanting more information about osteoarthritis and how you can help them.
All right.
Tell us again what that is.
Well, basically, osteoarthritis means bone-on-bone damage in the knee.
All right, now what causes it?
Well, basically, it's just caused from years and years of wear and tear walking, jumping, squatting, things like that.
All right. Treatment options, what kind of things are we talking about?
Well, basically what happens with osteoarthritis, first of all, is there's a joint capsule in the knee. Okay, so here's your knee where it bends. That little joint capsule has a lot of fluid in it. So just the years and years of wear and tear causes the fluid to leak out. So like a water balloon, when water leaks out, it's going to deflate. Same with the joint capsule, it's going to deflate, and you get the bones hitting together. And then the cartilage starts to wear out. So when you get bone on bone, obviously it's going to cause a lot of pain just by getting up, just by moving around.
Okay. Now, I know a lot of folks would like to avoid surgery. What kind of non-surgical options are there?
Certainly. When it is bone on bone, there is two options. One is surgery, like a knee replacement, and the other is for me to actually decompress the knee. And what I mean by that is when I decompress the knee, that creates a vacuum within that joint capsule to draw the fluid back in to help lift the bone off the bone so it doesn't grind. However, at that point, we want to repair the damaged cartilage. So I use what's called a class 4 laser to actually repair the cartilage.
How long does a treatment like that take?
Most patients go through on average about 10 treatments from start to finish.
Now, is this something that's painful or?
No, not at all. Everything we do is painless, non-surgical.
Okay, and if folks are interested in getting help with this, what do they need to do?
Give me a call, 910-798-5560.
Check out the website, spinalcareofwilmington.com.
Now let's talk to Health First partner Kuzma Advanced Dentistry.
Hi, I'm Megan Donahue. With me today is Dr. Michael Kuzma and one of his patients, Jessica Moore. Dr. Kuzma, what was so unique about Jessica's smile?
Well, Jessica came in and presented with something called dental fusion, which we rarely see. But in any case, dental fusion is where two teeth are actually literally fused together as if they were one. And in Jessica's case, it was her front 4 teeth, so 2 on one side and 2 on the other, were fused together. So instead of having 4 front teeth, she only had 2 front teeth. So obviously they were much larger than they would normally be.
Okay. Now, Jessica, what was that like growing up with dental fusion?
Well, growing up, I was picked on a lot. I was never very confident in my smile. I wanted to go off to college with perfect teeth, so I wanted a solution that was easy and simple, so I went to Dr. Kuzma.
Okay, and what was that solution?
Well, at first I didn't think it would be easy or simple because most people would consider extracting the teeth. But if we extracted the teeth and tried to do implants, basically she could be without front teeth for about a year, and it would really rely on everything going just right. And I thought, if this were my daughter and she was getting ready to go off to college, I wouldn't want to risk taking out her front teeth in hopes that everything would go right with implants. So instead, we had to think outside the box a little bit. I do a lot of cosmetic dentistry, and so we prepared her teeth for veneers, and we were able to make 6 veneers look like 8 teeth. So now I think she's got a beautiful smile that matches her personality.
Wow, that's impressive. How do you feel now?
I feel very confident in my smile, and I can't wait to go off to college.
That's great. And what can folks do if they have cosmetic dental concerns?
Well, I would say just give us a call or come in for a consultation.
Great. For more information, go to KuzmaAdvancedDentistry.com.
Now let's talk to Health First partner Carolina Oral and Facial Surgery Center.
Hello and welcome back to the Cape Fear Business Break. I'm Megan Donahue. Today I'm joined by Dr. Mark Buffalini from Carolina's Oral and Facial Surgery Center. Welcome back, Dr. Buffalini.
How you doing?
Doing well, thanks. What are we here to talk about today?
We're going to talk about placement of immediate implants.
Okay, and what is an immediate implant?
Immediate implant is a implant placement procedure that occurs at the same time as a tooth extraction would. The benefit of an immediate implant placement is that it saves time and it helps mold the tissues into a more aesthetic look at a final restoration.
Okay.
We have some pictures here of a patient that went through this process that we can describe. It was a young girl who had a trauma to her front tooth where she actually fractured the root underneath. She came in and this tooth was not restorable, and so at the time of the procedure we extracted the tooth and then went ahead and placed the immediate implant, and then at that time we took impressions of her teeth and had what's called immediate temporary fabricated by a lab, and so she came in later that day with her final restoration for that temporary implant. That temporary restoration. The restoration is a temporary, so it's not as durable as a final restoration, but it does allow to have an aesthetic appearance where the patient doesn't have to walk around with something removable and be self-conscious about that
Wow, and you did all that in one day?
Yes, it was all one day. Patient came in the morning, went through the procedure, and then came back later in the afternoon for the placement of the restoration.
Wow, and you can eat with that?
Soft foods, but no direct chewing trauma on that restoration.
Okay, thank you. Find out more about this by going to carolina-surgery.com.
Now let's talk to Health First partner Wilmington Wound Care and Podiatry Center.
Welcome back. I'm Megan Donahue, and I'm joined today by Dr. Richard Recco from Wilmington Wound Care and Podiatry Center. Welcome back, Dr. Recco.
Megan, it's good to be here.
Last time you were here, we talked about peripheral arterial disease. What do you do to evaluate that?
Well, the first thing we always do is you take a look at the patient, what's before you, and then you touch the patient. You feel for the pulses. There's pulses on the top of the foot, behind the ankle, underneath the knee, and you evaluate all these. You look at the skin. Is the skin warm? Is the skin cold? Is there hair available? If there's no hair, then there's no circulation to the skin. And then you're looking at the pallor. Is there whiteness? Is there redness? What is going on? You have to use your vision and your touch and your family history to evaluate it. And that's your initial look. And then from there on, we begin to get into more complicated or more technological things. And the first thing is the handheld Doppler, which we have here. This handheld Doppler amplifies the blood flow going through the leg. So we take it and put it over the artery, and we turn it up, and we hear a swoosh, swoosh, swoosh. And depending on the frequency, depending on the loudness, depending on the force, we can actually hear it. We can make a diagnosis if there's a constriction through there. This is a handheld portable one. The one we use at the office would have a chart, would have blood pressure cuffs, would have all kinds of things that would be more specific, and we could maybe localize these things to more precise areas on the leg, and then we could send you to your vascular surgeon and say, look, we need help here, we have a blockage.
All right, that sounds like you could help them if they were suffering from that. Thanks.
Wonderful.
Find out more at woundcarewilmington.com.
Staying healthy is important to you and to your family.
At WECT, we're committed to keeping you in the know.
With up-to-date local and national health news you can really use.
Go to WECT.com and click on Health First.
Learn about medical advancements, new procedures, and get advice from local providers.
Health First on WECT.com.
The best place to find vital health information for you and your family. Where do you go to get instant access to local legal resources and a whole lot more? WECT.com and Law Connect.
Get valuable attorney information and get it quickly. Go to WECT.com and click on Crime and Law.
You can even get up-to-date local crime and court reports, plus details on recent arrests in southeastern North Carolina.
WECT.com and Law Connect. Get instant access to local legal resources and more.
When you hear news about Wall Street and the government, you may wonder how your personal finances will be affected.
WECT.com and Your Money Matters gives you instant access to financial resources and solutions.
Get answers and insight from real professionals. Learn how to put your money to work for you and your family. Your money matters.
WECT.com and Your Money Matters. Instant access to financial resources and solutions.